Well, hello and welcome everyone to targeting IL-1 beta inflammasome and immunotherapy in cancer and other diseases using botanical medicine. This is a new talk for me and a new platform, being that we're not all together for one, and we're not even interacting. This is a tape recorded session, and so I'll do my best in every way. And this is also a subject I think that may be new for most of you as well, but I think by the end you'll be very surprised about how big and how important it is to understand IL-1 beta, inflammasome, and NLRP3. There's three main areas that we look to assess our patients. One is the patient themselves, we call host diagnosis, symptom presentation, observation, palpation, energetics, what we want to extrapolate from the patient, what the patient wants to actually tell us about their health. The next is to look at laboratory tests, which is a different lens that gives us different information, or urine analysis, things of that nature. And the third is more tissue-based or maybe genomic testing, looking at pathology in cancer. Three key inflammatory cytokines in cancer. IL-1 beta is mainly produced in tissue macrophages, so those tumor-associated macrophages. Dendritic cells, they're involved in angiogenesis, proliferation of cancer. They promote the development of cancer. IL-6 is produced in macrophages, T lymphocytes, B lymphocytes, monocytes, and it's involved in metastases, invasion, angiogenesis of cancer. It's a very good marker, again, if you want to go deeper than a CRP or a SED rate or a CBC and say, well, what's really, what else can we extrapolate in a more micro way? These are tests. I do run IL-8 sometimes in patients. It's related to VEGF, so it promotes angiogenesis, but specifically is a way of predicting often of vascular endothelial growth factor upregulation. So pro-inflammation is the key to arterial aging, not cholesterol, more so than anything else. We have other contributing factors, but more than anything else, if you control inflammation, often you can reverse heart disease in people. Here's andrographolide as a potent anti-inflammatory. Look at all the pathways used, all the areas that it may be effective in: asthma, COPD, cirrhosis of the liver, stroke, Alzheimer's, Parkinson's, rheumatoid arthritis, psoriasis, and I find it's one of the main herbs I use in my support for patients who have cancer as well. Olive leaf prevents cartilage degradation and osteoarthritis. So here it is specifically. I don't think in terms of olive leaf for arthritis, but recent research shows maybe I should. It also modulates hyaluronan metabolism in synovial fluid. Hyaluronan or hyaluronic acid is part of how your tissue, it provides that fluidity, that kind of synovial fluid. And it seems that echinacea boosted, Centella asiatica, godicola boost that, but here we have olive leaf specifically enhancing cartilage health. It's one of the glycosaminoglycans.